We are smack dab in the middle of tick season in Maryland, and that means the potential for Lyme disease. It can be a serious illness if you don't catch it early. Among the chirping birds, rustling leaves, and flitting butterflies of a Maryland summer lurks something much less appealing: deer ticks that carry Lyme disease.
This is Lyme season.
Dr. John Aucott is the director of the Johns Hopkins Lyme Disease Research Center.
So Maryland is a Lyme endemic area. We have the ticks that transmit Lyme disease, and this is the time of the year when the ticks are out.
It was about this time a year ago when Lindley Smith began to feel very ill shortly after a family camping trip.
I went to patient first. I saw my primary care provider. I went to the emergency room, and everyone just told me I just had some sort of viral infection.
The pain in her neck, overwhelming headache, wasn't going away.
But it was just scary. Mentally, it was hard because I had no idea what was going on. And, you think the worst. I thought, do I have meningitis?
Then, 8 days after symptoms began, this telltale rash appeared on her side.
That round red rash, people often think it's a spider bite, but it's not. So the mark where the tick bites occurs in about 70% of people. And so not always, or it may be there, but in a place you can't see. It may be behind your knee or in your back. And so also being aware of signs like fever and chills and unusual fatigue. And again, it's all the context. It's Lyme season.
And people often think the rash will look like this, like a bullseye. Dr. Aucott says only about 20% of Lyme skin lesions have this target-like appearance. Most look like this, appearing about 7 to 10 days after the bite. Dr. Aucott also says Lyme disease is easily treated with antibiotics if it's caught early enough. If not, the disease can manifest into meningitis, arthritis, heart problems, or
it can even kind of transform into what's called chronic Lyme disease. We actually call it long Lyme because it looks a lot like long COVID. And that's that kind of illness where despite treatment, you still don't completely get better and have almost like chronic fatigue.
He says the best way to protect yourself: shower off after being outdoors, cover up, and use bug spray, something Lindley did not do on her camping trip.
I was the only one that didn't use any sort of bug or tick repellent. I don't like all the sprays. I think they're kind of gross, but I didn't use it. And I was the only one that this happened to, so that says something.
Lindley says she's doing well now and continues to have follow-up appointments at the Johns Hopkins Lyme Disease Research Center, where they study the disease. She says she's happy to participate and hopes it will help other Lyme patients in the future. You can find more information on Lyme disease in the WBAL TV 11 app.